Okay, so we're going to go on to the session planning and risk benefit form, because this is what you should all be working for. So each YAC session is going to be different, because each branch, each venue, each activity is different. However, there are core things that you will always need to know. So knowing when you have access to your venue and when the volunteers are able to arrive and when they do arrive. The arrival of the YAC members. So where are they coming from? Where are they parking? Are they walking to you? Which entrance are they using? How are you meeting them? How are you registering them as well? The session itself and what activities you are doing, and then the collection of the YAC members. And in the toolkit, we have introduced a model procedure for late collection, for arrival collection and late collection as well. So you have guidelines there, if you haven't already got it in place, about what to do if someone is late being collected. And I'm sure all of us have had that situation at one time or another, where someone's been caught in traffic, or unfortunately, the worst one for me is they forgot to arrange, or the person who had been arranged to collect had forgotten that they were supposed to be doing it because it was a grandparent. So these things do happen. They happen quite rarely, hopefully. But having, again, a process in place, and a process that you can then tell the adults, the members, parents and carers, that this is the process we want you to follow, is really useful. And then at the end of the session, there should always be a debrief, a goodbye to each other as volunteers as well. So the session planning and risk assessment form is put into two parts. Part A is the session plan. And on the website, there is a Word version and there is an Excel version as well. So if you've got a session plan and risk assessment process that is working well for you and covers all of these, we don't expect you to change over to the new system. You're very welcome to. But if it's working for you and it covers everything, then keep doing it. If it doesn't cover all of these things, you might want to try out the new template and use this. So the session plan has the session title, what you will be learning during the session, which of the YAC leaders and volunteers are due to be there, the maximum number of members that can attend. So if you've only got 2 leaders, that's 16 children. And any other adults that are present. So this could be external partners, it could be parents, carers. It could be if you've brought in an archaeologist to talk about something or bring in finds, it could be them as well. So just make sure you have a record of who should be there. And then the session plan itself, it's got when time. Now this can be very loose, you can leave this blank. Some people like to really plan out specifically, you know, we're going to do this for this amount of time and then move on. What the activity is, what materials you need, and then who's leading the activity. So if it could be yourself or it could be another leader. Is extra help needed to support this? So for one example, I was working with 5-year-olds, and we were doing some experimental archaeology and building archaeology, and we were using saws. What that meant was that actually, if we have two younger children using saws, I needed 2 adults with them so that they could have one-to-one supervision. And we put down on that session plan who was responsible for that. Who were those 2 people? So they knew what to expect during the day as well. Any adaptations that you require for age, ability, or preferences? I don't want to speak for all of you, but you're likely to have someone who has learning difficulties or works in a certain way, or even have cultural reasons why they can or can't do something. So especially in cooking, where, you know, we made Christmas puddings once, and of course that has suet in there, and suet's made from beef, and I knew that I had a group coming who had Hindus in that group, so we just swapped it over to vegetable suet. They didn't even need to know, but it might be something along those lines, that you have a vegetarian or you have someone with cultural reasons why they can't have something like beef suet. And then any activities that they might be able to take home, how will it be carried? Where will it be stored? Those types of things. So hopefully that's quite straightforward and not too different to what you're already doing. Which leads us on to the risk benefit section of the form. So that's part B. So in this little bit, we're going to talk a little bit about why we write risk benefit assessments, what should be in them, what is a hazard, how we decide on the risk level, identifying control measures, reviewing, and where to get help. So we write risk assessments to help us think through our assessments, our venues, the sessions, to help protect ourselves and others from harm, so that the activities and sessions are covered by YAC's insurance, because if you don't have a risk assessment, you're not covered by their insurance, and to meet legal requirements. So it's legal requirements of ourselves and YAC with regard to health and safety. And what they should contain as a bare minimum, according to the law, is the hazards. And those are things that may cause harm, how they may harm people, and that's a consequence, and what you are already doing to control the risks. Now, something that comes from the play world and is recognised by the Health and Safety Executive is risk benefit. And it is about balancing the risk with the benefit. So if someone's learning a new skill, learning how to use a tool, it is going to be riskier than if they've used it before and they've been shown how to use it safely. So a risk benefit looks at the learning benefits of the activity. So it then uses a comparison of the benefits. So that might be teaching a new skill, developing good practice, and then the level of risk. And if the benefits outweigh the risk, then as long as the controls are in place, and as long as we have thought about it and shown due diligence in thinking about it, and we follow those controls, then we can do higher risk activities. And that is something that came through in the consultation, is about confidence. So some of the people who filled out the survey said that they didn't want to use open files or do baking because the fear of the risk of it being higher risk was the thing that put them off. So if you look at it as what are the benefits of doing this activity and what are the risks, our hope is that actually it will give you more confidence to do different activities. So the form is, again, hopefully easy for you to complete. So it has the branch name, the name of the person who is writing the risk assessment, when you did it, and the date that it's going to be reviewed. So that should be, as a bare minimum, annually. If it's a regular activity that you're doing. If it's a non-regular activity that you're doing, at least before you do it again. It should also be done if things change. And also, if you notice that something didn't quite work in the session, or you have concerns, review it straight as soon after the session as possible, because then you can write notes on it so that the next time you do it, you've got that reminder. So you then have the session activity title and description. This is so in case the paperwork gets separated and you know what it refers to. How will members benefit from this activity as well? So what are the benefits? And then we're into what many of you will recognise as a normal risk assessment. So you've got your hazards. So what might cause injury and or harm to someone? Who might be harmed? So anyone who might be affected. So if it's just the leaders, write the leaders. If it's everybody, you can write all, because that will cover everybody in the session. And then we've got a little bit of sums here as well. So we've got consequence. So that is, if something happened, what is the worst that could happen? And there is a scoring system that we'll go through. Likelihood is, how likely is that to happen? And then the score is those two timed together, and that gives you your risk, your level of risk. And we've done that. So in the Excel spreadsheet, it's all coded so that you just write in the score 1 to 5. Go back, 1 to 5 here, 1 to 5 here, and then it'll automatically multiply that, and it will give it a colour as well. So it will be automatically colour coded. You then put what your current precautions are. What are you doing? What have you got in place to either limit the impact, the consequence, or limit the likelihood of something happening? And then if the score is higher than you would like, what potential additional precautions could you put in? What could you make it do to make it safer? And then who's responsible for doing this? Who is the person responsible? So if you, for example, if you were cooking over an open fire and you had one person, one volunteer who was going to be looking after that activity or that area, supervising, you might say that that was the person who was named for that session as they're going to be responsible for supervising the open fire. Or if you're using tools and doing one-to-one teaching them how to use tools, it could be the person that you've nominated in the session plan as doing that. If it's you've got to buy something, it could be whoever you've nominated to buy that item. And the reason why there's a person responsible there is so that you have clarity within the group. Because if you've got multiple volunteers there, it's knowing who is looking after which bit. So, and it does lead on to what your role as the assessor of that risk is. Because you are considering the welfare of everyone in your group. So that's thinking about yourself and other volunteers as well as the members. Taking into account the changing needs and aptitude as the members grow and develop. So Janet's example, you know, they're 11, 12-year-olds. By the age of 11 and 12, they should know what a barrier means. Whether they ignore it or not is a different matter, but they know by that age what a fence means and a barrier means. You're mindful of the different needs. So that could be resulting from disabilities and adults, for children and adults, which make them more vulnerable than others. You can identify and examine. We've just had that discussion about crossing a road. We've just had a discussion about a pond. So, you know how to identify hazards. You know how to identify risk. And you've got that knowledge and skill already about the control measures that you can put in place that are in your control. They're your gift. There are some things that are out of our gift. So if you're working in another venue and you have a landlord, or you're working in a museum, there are some control measures that are outside of your ability to make decisions. So I used to work for the National Trust, our Young Archaeologists Club. We weren't allowed on a National Trust property to have children left without their parents or carers. So our Young Archaeologists Club had to have their parents and carers stay with them, which can cause some issues for some parents and carers staying with their children, because the children can feel a little bit inhibited about trying new things sometimes and other things. And you also know where controls can be found that might be inadequate or that you need to make improvements to that. And that's something around why risk assessments are dynamic. What you write on this piece of paper might not actually happen in reality, because you might have to actually think on the hoof because something happens that you have to put in a control. And that's where a debrief afterwards and reviewing your risk assessments afterwards comes in. So a hazard comes under these 6 headings. So physical. And this is the thing that we think of the most. So it could be excessive noise, it could be working at heights, could be electricity, it could be slips and trips, uneven ground. So we tend to think about the physical. Biological, we've all had to deal with this risk over the last 2 years with a pandemic. So a biological could be a virus, it could be a bacteria, it could be harmful plants, it could be insects and rodents. So those are all biological hazards. Chemical, It's just that we use chemicals all of the time, whether we're talking about washing up liquid, soap, whether we're talking about paints, or whether we're talking about acids and other materials. Environmental is the potential for any activity to cause damage to the natural environment. So that could be if you're using a cleaning product, such as bleach. You use that excessively and put an excessive amount down your drain, that actually is an environmental hazard. It could be working in the outdoors space and an activity that you do, like an open fire, if it's not managed, could cause environmental damage. Ergonomic is anything to do with our bodies. So anything that can cause stress, strain, harm, or injury to someone's body. So that could be manual handling, because I'm assuming a lot of you, if you work inside, you probably have to move activity tables around and seats around. If you don't, you've got a great maintenance team. It could be, it does not matter how many times I was told to crouch next to a child when they're doing an activity to help them, but when you're called over to a child to help them, you end up leaning forward, and that does havoc to your back. So it could be those types of things. And then psychosocial, and this is covered under health and safety legislation. So that's anything that might cause harm to the health, well-being, or mental health of a person. So this includes bullying, it includes stress, it includes microaggressions, it could include violence. So all of that is covered under health and safety legislation. When we're deciding on the risk, we've already talked a little bit about this. The risk has these two parts. It has consequence and severity. So what is the consequence? If it happens, what is the worst that can happen? And then the likelihood, how likely is it to happen? And we've given these a rating of 1 to 5. So in terms of consequence, the impact of the risk, number one is discomfort, slight bruising, self-help, recovery. If you cut yourself and you put a plaster on it, it's going to heal quite quickly. Minor is a small cut, abrasion, where you need that basic first aid. And then moderate is, a strain, a sprain, and incapacitation for less than 3 days. So if they're back to school, they've hurt themselves on a Friday and they're back to school on the Monday, that's moderate. Major are things, so if they ever break, if it's any fracture, any break, if they've been in hospital for more than 24 hours, if they're not back to school, or they're not able to do activities for more than 4 weeks. So that's major. And then 5 is catastrophic, so death. The likelihood, again, we give this a score of 1 to 5. So very unlikely is the lowest, so that's almost never happens. Unlikely, it might occur, but it's quite rare. Fairly likely, it could occur, but it's uncommon. Likely, it infrequently occurs. And 5, it's very likely, so it regularly. Yes, when things do go wrong, they are an accumulation of things that happen. what we look at in this is what is within our control. That's all we can do, is look at what is within our control. So if we have safeguards in place, and this is where communication is really, really important as well, is looking at how do we communicate with all of the leaders and volunteers? How do we communicate with the members in different ways to go, do you know what, if something goes wrong, come and ask us, come and get our attention and come and help, and we'll come and help you. Accidents are just accidents. Accidents happen when we've put in as many precautions and we've thought about it as much as we possibly can, and something still goes wrong. And they do happen, thankfully rarely, and touch wood, very rarely, but they do happen. And it is, I know of one teacher who was holding 2 children by the hand, got distracted by a 3rd child, and one of those children stabbed the other one with a pencil, and they just turned their head for like 3 seconds, and they were holding hands. These things happen, and they are accidents. We can only control what is within our gift to control, and that's it's a difficult thing to accept sometimes, especially when we've experienced it, where you've had that almost like a domino effect, isn't it, of everything happening at once. And that's where it's also really important to have other leaders and volunteers with you. And when we're going back to that session plan, is being aware of what everyone else is doing, what their responsibilities are, especially if you're doing something that could have higher consequences and not necessarily likelihood. Okay, so I'm going to very quickly look at one more screen, and then we're going to have a 5-minute break so that you can all go get yourselves a cup of tea or coffee or whatever drink choice that you want. And that is the risk matrix. So we've put this together, and this is on all of it at the bottom of all of the forms, and in the Excel form it will color code it for you automatically. So if the consequence is low and the likelihood is low, then it's going to be pale green. And that's where you ensure that the controls you've put in place are maintained and reviewed, but actually you don't have to do anything because the risk is low. The next band is dark green. So this is where, you know, you're talking about catastrophizing. You know, your risk of, you know, someone going over a clear barrier and going into a pond and dying. That's your consequence, that's 5. But it's really unlikely to happen because there is a barrier, there are precautions, you're with them, you're going to give them a safety talk. You've put all of those precautions and controls in place. So the likelihood is really, really low. So that means you just monitor it. You look at how you might improve it at the next review, or if something happens or significant changes. You know, so you've done all of this, and then part of the fence is broken. You would have to then monitor it because the risk would increase. Amber, you know, is that middle of the range. You might want to put in a few extra controls, usually within 3 to 6 months, and that could be, for example, you want to cook over an open fire, and I keep talking about open fire because that's something that continuously came up in the surveys, or you might want to do some archaeology, but you're concerned that there might be something in the ground. So, for example, I project managed an archaeological dig on a First World War site, and we thought there might be a bit of asbestos, which then increases the risk. And it was, you know, we made sure that the actions and procedures were in place. And that's usually within 3 to 6 months of putting things in place. It could be additional training needs. So you might know that you're currently qualified for first aid, but it needs renewal, or your first aider is going to be retiring, and that's where that, you know, that specific time frame action, you know, you go to Joe and Rachel and say, we need first aid training, can you help us with that? You then have your reds. So these are where it's, you know, high consequence and medium to higher likelihood. And that's where you just have to look again at maintaining controls and what additional controls that you might have. And then the highest ones, these ones here, where, you know, it's really likely to happen, really high consequences. That's where you go, actually, I'm not sure if I want to do this anymore. That's where you think, should we be doing this activity? How can I make it safer? If I can't make it safer, we don't do it. So on that note, we're going to move into identifying controls, reviewing, and pulling that all together when we come back from our break at 3:15. At this, we'll make a start. So still looking at our risk assessment and how we identify control measures. So any control measure should meet basic legal requirements and show best practice. So they can include eliminating the hazard at the source. So if the hazard is the pond, either not going there or filling the pond in is going to eliminate the hazard. If the hazard is burning yourself on an open fire, then to stop that risk completely, you wouldn't have the open fire, which would then ruin all our fun. So the other ways that we can do that is reducing the hazard or removing the person from the hazard. So, and containing the hazard by enclosure. So the hazard of that pond, it was enclosed with a low fence to stop people from getting to the pond edges. Welcome back, Janet. We're just talking about identifying control measures. So it could be about if you're cooking, whether that's using an oven or a fire. It could be if the risk is more children hurting themselves when they're putting something to cook in the oven. It could be the adult does that part. So you're removing the person who's most at risk, but they're still part of the activity. They're still, but someone else does, who is less at risk, does that activity. Reducing employee or visitor exposure. So that could be if you're working outside and it's a really hot or a really cold day, It could be limiting the amount of time you're in that environment before going somewhere. If it's a really cold day, before going back in to warm up. Or if it's a really hot day, before going sitting in the shade and having something to drink to keep hydrated. So it's reducing the exposure. It's reducing the time that you are exposed to that hazard. It's putting in place systems of work. So those could be instructions or supervision. And where necessary, providing personal protective equipment. So that could be as simple as a pair of work gloves. It could be as simple as an apron. If someone is really upset by very loud noises, it could be a set of headphones or ear defenders. So it is personal, it is protective, and it covers a lot of things. And that's one of the control measures that are within our gift to provide. So if you've got any questions, Caitlin, if you have to go, don't worry. Any questions about control measures? No? Okay, so pulling it all together is going back to this form. Is the hazard is what might cause injury and or harm to someone. Who might be harmed is whoever is affected, might be affected. The current precautions are what you've already put in place to limit the impact or likelihood of something happening. And potential additional precautions are things that you might do to lower the risk. And then that named person, leader or volunteer, in your cases, I'm assuming that's all leaders, who are the person responsible. And I would avoid, where possible, putting someone's parent or carer down if they're staying for the session, because you never know if they're going to be called away. Then reviewing it. Risk assessments and all health and safety planning documents are not designed or should not be designed to be written, go in a folder on a shelf and get dusty. They are meant to be dynamic. They are working documents and things change. So they should be reactive to changing situations and conditions. They should be reviewed at least annually or when changes occur. Or if it's an infrequent activity, before the next time that you run that activity. And if it's a new activity to you, or you've noticed something like a near miss, and a near miss is something where some harm could have been done. It is literally, it is a near miss. It could have been harmful to them, but thankfully it wasn't. But it was because the controls weren't being implemented or weren't quite right. So if you can see things that could have been done better, more safely, or if an accident or incident occurred, it is always worth having that debrief. And you can do that in 5 minutes at the end of the session. Or you can say, oh, can we have an email conversation? Just send it around each other to get feedback, as long as it's recorded. What I will say is, if it is not recorded in one form or another, it does not exist according to HSE. So if you've reviewed something after an accident and you can show that you've changed it, make sure you. So it's really important that A, you have it written down, but B, that you share the information, because that is part of your control process, is to share that information. So it could be that you sit down, you're doing a new activity and you sit down and you write it together. It could be that one of you really enjoys doing the risk assessments and the session plans, and you do that, but you make sure you send it out to everybody. Or you take it in turns. If there's several leaders, if you take it in turns, because it does two things. It gives it value to everybody, all the leaders, and also it gives people time. See, it's not just one person who has to find the time to do this. You can take it in turns and share the load. Make sure that all branch volunteers see it and can comment on it as well, because again, it's a perspective thing. You might have someone who has experience in other areas where they might go, oh, have you thought about this? Or how about we do it? We do it like this. Ensure that it's available during the session. So if you need to refer back to it, it's there. Also, if a parent or carer asks to see it, you'll have it to hand. Have a pre-session briefing to go through the activities. You probably do this already. It doesn't need to be formal. It is just, okay, so today we're doing this. Does everyone know what they're doing? We need to be aware of these things in particular. And then discuss any thoughts, incidents or near misses after the activities that can improve safety in the future. Also consider how you're sharing the information with your members as well. And this will depend entirely on their age and ability. So I've worked with 12 to 14-year-olds where actually for some activities, I get them to do the risk assessment with me. You know, they'll tell you very quickly how they should be behaving. They know. They will know. Even little ones, I've worked with 4 and 5-year-olds around using tools and around open fires. And I've said, okay, so if we were to run around this area, what might happen? We'd fall over. Okay, well, if we fell over and we were carrying this, what might happen? We'd cut ourselves. Okay, so how can we make sure that we don't cut ourselves? Oh, well, we can hold it like this, you know, if you're using scissors, holding it pointed with the blades going down, and we don't run, we walk. And that's 4 and 5-year-olds. They know how to risk assess. And it's just, could be just asking questions to get the answers from them, because they're more likely to do it if they'd given us the answers as well. And explain the reason why something can't be done, especially if they can do it another time. So I remember I was working with a nursery group once, and we were doing forest school, and this was 3 and 4-year-olds, and we had an entire conversation one week about why we couldn't climb a tree because it had been raining really heavily overnight and the wood was wet and slippery, and what might happen. And the next week we were back there, and a 4-year-old boy told me that he could climb the tree this week because it hadn't been raining, which meant the wood was dry so they wouldn't slip. But he couldn't actually climb on that branch because it was too thin and it might break. We'd had no conversations about that, but as a 4-year-old, he'd been given the language and the tools to actually start coming up with his own risk assessments. So the language we use, and not using things like, don't do that, don't run, don't carry it like that. If we can change the language and reframe it to, can you hear, you know, if you're next to a river, can you hear running water? What does that mean? What do you think's over there? What's your plan? How are we going to use this? Just changing our language and tailoring that language to the age and ability of our members. And again, we all know our members. We know what they're able to do. And they're usually able to do a lot more than some adults give them credit for as well. I'm not saying us, I'm saying some. So it is that using the language to get them to almost tell us how to behave and get them thinking about it. Now, there are some scenarios where we are going to have to react quite quickly and say, don't, come away, keep away from the edge, those types of things. And then we can have a conversation afterwards once their safety is ensured. And then sharing the information with parents and carers as well. So parents and carers are well within their rights to ask us to see our risk assessments, which is always good to have it there so that you can do that. But they might need additional information. So if you've got a special activity, so you're going on a field trip or you're cooking, you're going to need them to know additional information or give additional permissions to do things. It might be around attendance and illness. So if, I mean, we've had it with COVID, you know, if someone's been to a session where they've tested positive, you've had to, or having to ask people not to attend if they're showing symptoms. The same could be said for any childhood illness. You know, if someone has got measles or something, you know, it is within the education world, there are illnesses that you have to let people know if someone has come down with it. It could be about having a conversation with people at the beginning and end of sessions. So if something's happened, letting them know. If you're doing something and they have any concerns, talking to them at the beginning of the session as well. Display a simple poster where parents and carers can see it easily. And I have a feeling, I don't know if it was Carol Ann, but someone else was saying about someone had a nut allergy. So they put up a poster and they banned nuts from the entirety of their sessions. So they asked everybody not to bring nuts as part of their sessions.